Hello, hello. Welcome to Juicy Talk. I'm pre-recording today because I have a very special guest, Dr. Harold Jones, who's going to come and talk to us about men minority health. He has a very busy schedule, so we had to record it early, and we're just so grateful to have him. And we're going to get started. So let's go. Welcome to Juicy Talk with your host, Juicy. Live Thursdays, 8 p.m. Crucial conversations, special guests, love, relationships, and healing together. It's going to be juicy, y'all. Let's go. Okay, so before I bring Dr. Harold Jones on, I just wanted to go over. He graduated from Virginia State. He went to he did his residency at Mercy Hospital in Detroit. He graduated from Ohio School of Podiatric. I might be saying it wrong. School of Medicine, and he also has his own private practice. We Care Health. We Care Health consultant. He's been a consultant for many different insurance companies, hospitals of such nature. So we are very excited to have him, and I'm going to bring him to the stage. How you doing, Dr. Jones? How are you today?
Thank you. Thanks for having me. Good afternoon. Welcome.
I'm so
Welcome.
excited to have you today. This is a very important subject to me. I have a father who is, getting older. He's in his 70s. And even though I'm very lucky that he's healthy, I have several brothers. And, I know that as time has gone on and just men don't go to the doctor as they should. They don't go to the doctor. And sometimes even when they do go to the doctor, they don't know actually what to say to the doctor. So this was something that I really wanted to talk about, some of the issues that I see affecting the men in our community. And so I'm just so very happy to have you today.
Yes, thank you. Thanks for having me.
So we're just going to get right into it. One of the things I wanted to talk to you about, being a doctor for as many years as you've been a doctor for over 20 years, and practicing for over 20 years. I just have a question. What is one of the greatest medical issues that are facing African American men and minority men today?
Hands down is the disparity, health disparity for people of color and especially males, to say the least. It's a disparity factor.
Yeah.
Greatest issue, disparity factors.
So, and when you say disparity factors, can you kind of talk about some of those factors that play into a part when it comes to African American men?
Yes. Well, first of all, what happened is that, or what I've experienced on both sides as a doctor and being African American, is that men, most men, let's say if we're talking about men, men don't normally get to the doctor unless they're at the end of literally at the end of whatever their conditions is. As a foot surgeon, for example, when I saw men in my practice, it's the last resort, meaning I have to go and do an amputation.
Mm.
It's that bad
Mm.
from that perspective. Men seldom comes to the doctor by themselves, and when they did show up, their wives are literally dragging them in the office, dragging them because men, men we're macho and it's like, I'm okay. What's wrong with you? I'm okay. And by the time I look at their foot, the wife finally bring them in. I can't I can't salvage anything in essence, save it. It's more like Mr. Johnson or whatever their name is. I got to take you into the emergency to the operating room to do an amputation, be it a toe or foot or what have you. But going back to the initial question of disparity, is that oftentimes as people of color, we are being treated differently. In essence, that my counterpart of a different color persuasion, to say the least, oftentimes look at people of color differently and institute treatment options differently, meaning that something that may be salvageable they may go out and say, you know what, let's cut it off.
Mm, I think your camera froze up a little bit. But I would say that that's one of the things that I have seen too in our community is that a lot of times men, just Black African American people, period, we're not actually listened to. If we say we're in pain or we think something is wrong with us, they minimize it a lot of times when we go to the
Absolutely.
doctor as if we don't feel pain or we don't know what's going on with our body. And I
Well,
also
well,
find
well, go ahead.
I also find that, as like with my parents, as African Americans get older, in the older generation, they really have less say so. They basically do with whatever the doctor tell them, and they don't get second opinions. And I think, or they don't go for fear, out of fear.
Well, what I would say with that part is true, but we got to remember that the older population, our parents' age, for many of them, they were told that if the, well, first of all, there were fewer of us that looked like them to bring the same level of treatment options or information to them. So they were told whatever the others told them was literally the Bible. So they were told one thing and that's what they went by. They didn't challenge it because if they did, first of all, they didn't know what they were challenging, number one, because they didn't have that understanding of what the situation is. So they were told one thing and they went along with it. On the other hand, where people like myself, who looks like them, when I see that or they see people like us, we look at them as that's our parents. So we bring something totally different, but yet where they understand us and we understand them and say, hey, I would treat you like I treat my mother or my grandmother. Whereas the others look at them as, okay, well, if it's a foot or leg, they don't need it anyway. They're 80 years old. They just chop it off. And studies have shown that within 2 years, less than 3 years, you do an amputation of a limb, those patients are going to die much quicker.
Mm. And I've seen that firsthand
Yes,
from people that I know who have struggled with diabetes for years and,
yes,
pass away because of right after a couple
yes,
less than a year
yes,
after that.
exactly. That's exactly the point.
Yeah,
So as surgeons or as doctors who are dealing with in this realm, we should be more sensitive. Now, people of color like myself, we seem to be more sensitive because we understand what goes on in our community. We understand the disparity issue and how we are treated and looked upon, and therefore the treatment matched the way they see us, meaning lack of value.
mm,
But for people like myself, when my patients would see me, especially the older patients, geriatric, they would smile because I represent one of them. They
mm,
see me as their child or their grandchild. So therefore, they were able to, it's easy to treat them or deal with them. So when they see me, they understand, they knew that I'm bringing something to them of value and I would value them and therefore it's easier. On the other hand, my other colleagues of a different persuasion didn't look at them with the same level. So therefore, to have this disparity factor, going back to the initial question, he said, what's face? Is that. And that's why a lot of us die sooner or not getting the right treatment, for lack of a better word. But that's the gist of it. That's what it really is. And I've seen it numerous times, and I made sure I was a roadblock to them doing that to us. But I'm only one individual.
Is that lack of empathy, or is that us not knowing the right questions to ask, or a combination of both?
Well, it's a combination. It's a multifactorial. One is their lack of empathy because when we look at how we are treated or viewed by the other persuasion, it's always lack of value, of worth, of what how they view us. Their perspective of us employs the treatment plan that they're going to use to save our lives or lack thereof. And what they're going to offer to us is not always the best plan for us or the black best plan, period. But because they lack value in how they treat us, then the treatment options oftentimes are like that. And I could write a book about that, of
Yeah.
how many times I have intervened and blocked others, surgeon to surgeon,
Mm.
of what they wanted to do to one of our people versus what was the best option. And me, some call it arrogance, some call it whatever. I stand on what I stand on, and I made sure it wasn't going to happen. I had a situation, and this is probably the first time I'm putting it out there openly. I had a situation, one of our geriatric patients, older patient, family, had a lot of family members, always surrounded them, love, family, reminded my own family. And one of the big name vascular surgeons in town at a very highly reputable institution says to me, we both were consulted on the case, and she just needed a toe amputation because
Mhm.
that's what she needed. But I wanted to make sure her circulation status was good. So I had the vascular surgeon take a look at her, make sure her circulation status was good. And then when we look at the results, I'm looking at the same results he's looking at, and he tells me that he's going to do an above the knee amputation,
Wow.
and all she needed was a toe
Wow.
amputation. So then I question him. I'm looking doctor to doctor, surgeon to surgeon. We have the same medical knowledge. So we're going. I'm like, okay, this is what the test said. This is what the results said. None of it is indicated for what you want to do. And I'm going on the facts. I'm looking at the result that he's looking at. And he had the nerve to say to me, well, she doesn't need it anyway. So he was going to take her leg off above the knee. And
Wow.
all she needed was a toe amputation. So, just an example, call it my arrogance, but just me doing what I do to ensure that we're not going to have them do whatever they want to do. I blocked him, stopped him, canceled that surgery for the knee amputation, and ended up doing the simple toe amputation, which would have buy her another 5 years in life. She was already up in age. But his word to me was, well, she didn't need her leg anyways. Okay,
Oh,
and I'm a doctor,
wow.
but he forgot that I was black or
Wow.
person of color.
It's just it's beyond
Comprehension, yes,
comprehension
yes, yes,
that some would make the statement, "She
yes.
doesn't need her leg." Why would you not need your leg?
Right,
I
and
I
it
just
goes
can't
back
even.
to the value of how they view us. Okay,
Wow.
this person in particular, she was like they would say, Big Mama in one of those home, like Tyler Perry movie. She had all the love. That room was always filled with
Mm.
family members. Okay, but when he says to me, and again, no one else could check him but me. We both surgeons. We both understand the same thing. And I'm looking at the lab reports, all the studies are coming back that said she had good blood flow that would heal, and all she needed was the toe amputation, which is almost nothing. He was going to use that same info to take her leg off above the knee, which
Which would
she
have
probably
left
would be
her.
done in months.
Yeah, because she would have had
Yeah,
less mobility. She probably would
no
have start
mobility.
no more mobility. She wouldn't have been moving around in the.
So here, but let me just jump in and give you the real reason why they died much quicker. And most people very rarely, seldom know that. If I'm teaching young doctors, this is what I would harp on. They died not because the surgery didn't go well. They died from depression.
Mm.
Because now that person now has to depend, like you said, no mobility. They're feeling like they've been independent all their lives, and now they need everyone to help them to go anywhere, do anything, and everything they need to do. They can't do it by themselves anymore, especially in that generation. They're very independent.
Mm.
So now you are depriving this person of a limb when it was uncalled for. Nothing in that record, I repeat to you, doctor to doctor, surgeon to surgeon, nothing in that record indicated what he was going to do to her. Okay? So just imagine if I wasn't that guy.
Mm.
He had on the surgical schedule for a knee above the knee amputation by the next morning. And guess what? Call it arrogance. I checked him and said, you know what? You're not going to do that. You were canceled. I was on my way to the hospital, went up to the surgical area, canceled him off that schedule, insert myself on that schedule, and just did a simple toe amputation. It doesn't affect her life. It doesn't change anything.
Mm.
She could probably went on to live another 5 years, whatever that was. It is. But with her situation, she would have died probably less than a year. And this is what happens and I use the word the disparity factor. This is the lack of value, how they see us as people of color.
That's shameful.
And this is, and I'm giving you, I hate to, this is first I'm actually putting it openly on a platform, but I've seen several situations like that. But when it came to my situation, be rest assured, I was stopping it. I stopped it. And he's a big name, I repeat, big name, head of department in one of the top
Yeah.
hospitals. And when you said his name, others would be like, oh my God. No one would question that. But guess what? I stopped him.
And I think that's one of the things that, I really feel like we need to talk about more is we need to allow and let people know that you can question your doctor and get a second
Yes,
opinion
you're
and that you
supposed to.
should.
But also too, one needs to have that doctor speak or break it down to levels that they understand and not just using medical terminology. And when you go to the doctor, what did the doctor say? Well, I don't know, but he just said this. So as it relates to, let's say, my parents, I just lost my father a year ago. Guess what? Anything medical ran through me,
Mhm.
and they lived in New York. Everything medical ran through me. That's how I did that because I know
Yeah.
what happens. So either I'm calling that doctor or they get to that doctor's office. My mom or my dad will say, okay, talk to my son. Doctor to doctor, what they wanted to do. Now they know, yeah, they got a son. I mean, a son that is a doctor, a surgeon. So therefore, they can't run no nonsense. So now it's a different ball game,
Mm.
and that's how it has to be done. It should be done. I think the doctor, you got to hold those doctors accountable, always get a second opinion. But again, if you don't understand or you're intimidated by your doctor or well, that's a doctor. Well, I get that. I'm a doctor, but I welcome questions because it gives me a chance to break it down, make sure when you leave the office, your family knows what your situation or condition is and what the treatment options are and how well we can get you back to where you need to be, or if you need to get a consulting, to see another consultant for another condition or the referral. And that has always been my approach.
And so do you recommend that in a situation where someone may be struggling with diabetes or high blood pressure, that they would always get a second opinion before any surgery is ever performed?
Well, yes, any surgical situation, first of all, you must have trust with your doctor. That should be number one. If you do not trust your doctor, just like if you go to court and you didn't trust your attorney, then it's time for another one, right?
Very true.
So that has to be number one. Trust has to be. And if you believe in your doctor, because and you assume that they give doing the best thing in favor of you, then when they make a referral, then that should also the trust factor should be there because they're advocating on your behalf for the best outcome of putting you in the hands of the best consultants. So any surgery should have a second opinion, um, especially if it's a complicated situation. But if you have a good PCP or primary care provider that you trust and he trusts you, well, trust going both ways. And if you trust that doctor to do, and he has been beneficial in everything that you have done, then I would trust that he or she will do the same thing to make sure they put you in the hands of the right consultants for your procedure.
So you mentioned primary care physician. Can you speak on why it's important for men to have a primary care physician? I hear like amongst the men that I know, a lot of times if you ask them who's your PCP or who's your primary care doctor, they're like, I don't have one. I just make an appointment. Can you kind of just for our audience explain why it's important to have a relationship with your primary care physician?
Okay, so I'm a specialist. I'm a foot and ankle specialist, so I'm not a primary care provider. A primary care provider, by definition, they're the gatekeeper of medicine. So if you're going to see a cardiologist, they're not, which is a heart doctor,
Mhm.
they're not a primary care doctor, physician. You go see an orthopedist for a broken hip, fractured hip, they're not a PCP. A primary care provider is your like your internal medicine doctor or your family, call your family physician. They are the gatekeeper. There you go for you got a headache, you got your nosebleed, you wake up and you're not feeling well. They're the first people you should contact. They should be your personal doctor. They're your personal provider. They're if you're in sports for men. If I'm talking to a guy, I would say your primary care doctor is like your quarterback. They're
Mm.
the main guy, and they pass the ball to everybody else. So your personal care provider is the one going to say, "Well, you need to see your eye doctor." Oh, you need to see an endocrinologist because your diabetic situation is too high, or you get or take care of your high blood pressure. Oh, by the way, you got a heart murmur. You need to see your cardiologist. They make all the referral, or you got a foot problem. You need to see your foot doctor like myself. They'll make the referral to people like me. So not only a male, every person needs to have their primary care provider, and that's why the word primary meaning number one. And they spread referring to all your other consultants.
So I want to kind of talk about diabetes and high blood pressure because there's so many things that it seems like if a male has been diagnosed with high blood pressure or diagnosed with diabetes, it brings about a lot of other problems that not only affect them mentally, but affect them physically. And so I wanted to, if you could talk about why is high blood pressure and diabetes so prominent amongst our community after it seems like the age of actually it's starting to seem like earlier than 40, but definitely after the age of 40.
Well, diabetes and high blood pressure fall in what you call the metabolic type of diseases or syndrome. Those two linked together can wreak havoc for the body. So, for example, hypertension or high blood pressure is diagnosed as over 130 over consistently. It used to be 120 over 80 is the norm. But
Mhm.
what's being said now is if you got consistently blood pressures ranging over systolic pressure 130 over 80 consistently, you will now become hypertensive or high blood pressure, maybe mild hypertension, and that's a new number. Um,
So one
the
that's
di-
130 over 80 is like prehypertensive
right, it falls in that pre-hypertensive.
or stage 1
Yes, stage
hypertension.
one. It's hypertensive, but needless to say, you're on that hypertensive, the increase in blood pressure side. And if you're African American, it spells a situation where, you know, well, one of the major things with high blood pressure, let me jump ahead, is that if it's uncontrolled, you can end up with a stroke. Period. And we see a lot of people with strokes. Oftentimes, the blood pressure, it affects, what happens is the blood pressure within the vessels becomes too high, and if you get one of those that pop or break or bust or whatever have you, you end up with a stroke. And for many of us, we die, but a stroke is one of those things we try to avoid by controlling the blood pressure. On the other hand, if you have um, on the diabetic side, if your blood sugars start getting too high over 110, 110, 120, 130, you start getting into that high blood pressure, excuse me, not high blood pressure, the diabetic
Mhm.
situation, those things can lead to, it impedes healing, which can lead to um, end up down the line with amputation, where I did more amputation than I needed to do in my book, but oftentimes it was late. My motto was to save what we call salvage. But if by the time I see you, you pop up in the emergency room at any of those area hospitals that I was on staff, and I get a call from the emergency room and you got gangrene, your foot is falling off because your sugar got too high. Let's say you got a pinprick or something got into your foot or you got a cut and it get infected, and because now you lack sensation, meaning you can't feel,
Mm.
and that's what leads to the amputation. So the higher the blood pressure, your healing potential decreases. So it makes it harder to feel. We call that neuropathy. You can't feel or sense. Now you're walking right now and you're a normal person. You stub your toe on the bedpost. You feel that. For a diabetic patient whose blood sugar is consistently elevated above normal, they may lose the ability to feel that. So now they may get a bruise, and what happens, bacteria is always around. It gets in that wound, it festers, it gets infected. But one of the senses that we have is to feel. And if you can't feel, then you don't know. So by the time someone sees it, oh, by the way, look at your foot. Oh my God, you got a wound. Oh, it's smelling or it's odorous. I got to bring you to the doctor. By the time you come see me, it's maybe too late for me to save that toe or save that foot. So now I have to amputate that toe or that foot. We put you at risk. So now I got to make sure you go into your personal, your primary care doctor to keep your sugar under control, whether it's on insulin or whatever that is they need to put you on. And if your blood pressure is too high, we got to get there. So it creates a whole host. When you put those two together, um, it becomes problematic. And also, too, in our community, black community, our diet also dictates our high blood pressure and the diabetes. Because think about it. I've seen people, let's say, they go to McDonald's and they order for fries, and before they even tasted it, they take the sugar, salt, and they start pouring salt over it. Okay, so now your blood sugar is going, your blood, not blood sugar, excuse me, your blood pressure is going to go out of whack. We love all the sweets. We're going to eat all the cakes and, all the sweets and put our sugar. Now, hemoglobin A1C is out of control, which hemoglobin A1C simply means that is a way of controlling, well, not controlling. It let us know how well we control our blood sugars. So all those things are out of whack. And now we're in a big trouble. So a lot of it has to do with that. Some is genetic, but a lot of it has to do with diet, how well we control our diet. And we love the good foods and spices and salts, and that leads to that. So we see a lot of our people when our high blood pressure, we suffer from hypertension, which is aka high blood pressure, or diabetes because of the same things. We don't, diet plays a major role in that. In fact, in that factor.
And so when it comes to high blood pressure and diabetes, what are some of the early signs that people may notice, like, before it becomes a problem, but some of the things where maybe it's still in the stages where it could be corrected if they pay attention? What are some of those early signs or of high blood pressure or those early signs of, diabetes?
Well, for hypertension, aka high blood pressure, it's called the silent killer. It's silent. You don't really know you have high blood pressure. That's the problem with high blood pressure. It's hard to say give a sign because it's silent. You don't know it. It's always present asymptomatically, meaning there's really no true symptoms
Mm.
until you show up at your doctor and find out your blood pressure is extremely high. You may have issues, but there's nothing to point to. Oh, you got high blood pressure. It's called a silent killer for a reason because it is asymptomatic from that perspective. Whereas for diabetes, you may have frequent urination, thirst. You're very thirsty, oftentimes, that kind of thing. So it can point to that. That you can say, well, maybe you're going into the diabetic situation. Again, the polyuria or polydipsia, the medical term we call for that. So that's a little bit more signs that we can point to that. And it's easy to diagnose that, that part. But as it relates to high blood pressure, it's silent. It's almost asymptomatic.
Mm. So I hear a lot of, like when I have my women's circle, right? And we talk, and a lot of times when people talk about, their husbands and different things when it comes to health, they talk about erectile dysfunction.
Yes.
And, a lot of, and I just want, if you could touch on or speak on erectile dysfunction and high blood pressure and the correlation between the two, if
So
there is any.
yes, I looked at the numbers. Is there every year there are over 3 million um, men that are diagnosed with erectile dysfunction, aka impotence. And what that simply means is the inability to maintain firmness during intercourse. They may get it for a quick second, but it's hard to maintain. So, and that's a high number, 3 million people.
It is.
Now, I mean, well, 3 million people, 3 million men a year on
Yeah,
top of
it
what's
is.
already there. Um, the blood pressure controls flow. Erection is blood flow. Let me kind of put it gently. Blood flow is important for an erection. So if you have inadequate blood flow to the genital area, that will impact the infection or the ability to stay firm. So now the going back to the initial question of hypertension, high blood pressure. So now you have high blood pressure. The blood vessels are going through issues. So that patient now who are hypertensive, aka high blood pressure, goes to their doctor. Their doctor gives them medication to reduce the blood pressure, which now affects blood flow to that area, which now is almost like a domino effect, reduces the level of impotence. So now, if I had to sum it, so it's a domino effect. So again, high blood pressure.
Put it in layman terms,
Okay, I'm
please.
trying. Okay, so layman's it's a
This
dominant.
this is
Okay,
the crucial conversations. You can keep it
okay,
all the
yeah,
way real.
yeah.
This
Okay,
a
all
late
right. I'm
night
trying to
show.
be right. So okay, so the high blood pressure. Now those patients are on medication to reduce their blood pressure, right?
Hmm.
Now that high blood pressure now affect the ability will reduce or affect that patient ability to stay firm or to maintain an erection because if blood pressure increases erection, right, and you're reducing the blood pressure by the medication, now the erection goes, I mean, you can maintain a erection or even get one. So now you have erectile dysfunction. You look
Okay.
puzzled. Let me restate that.
No, I
So,
think I get what you're
okay,
saying,
let
but
me say
say
it
it
again.
again, though.
Okay, so blood pressure is important with a man maintaining an erection, right?
Mhm.
Adequate blood pressure, not the extreme blood pressure situation that will make you get a stroke. Because now the pressure in those vessels are so powerful that it will, can make you get a stroke and everything else. So now you go to your doctor. Now you're saying your doctor's saying you're hypertensive, meaning you have high blood pressure. So they're going to put you on medication to reduce the blood pressure, right?
So it's lowering your blood pressure. It's making it low.
So as you reduce the as the blood pressure reduces, it now affects your ability to gain an erection. The
Mm.
medication is doing that now.
Mm.
So now you can't, I won't say you can't, it makes it extremely difficult to gain an erection because the medication now you're on is also doing that.
Mm.
So high blood pressure is the bad thing for men because you cannot maintain high blood pressure and
The low
without
blood.
medication, or else you will die. You will end up with a stroke or subsequently die, right? So
Correct.
you go on medication, and if let's say you didn't know you had high blood pressure, or it's not uncontrolled, then you're going to be with a stroke, and you can't do anything anyways, right?
True.
So now you're on medication for the hypertension, or aka high blood pressure, which now will affect your ability to gain an erection. Make a long story short. So now it adds to your level of impotence, meaning nothing is going on.
And, you see a lot of times when it comes to erectile dysfunction, they say, like with medicines like Viagra and stuff like that,
Yep. Hmm.
that they can't be taken along with blood pressure
Medicine, yeah.
pills because it causes more. Can you speak on that a little bit?
Well, there is an interaction between both. I mean, one trying to reduce blood pressure, the other one trying to increase blood pressure,
Mm,
right? So the blood pressure medicine is going to save your life because if it goes uncontrolled, you will end up with a stroke, which means one of the blood vessels in the brain is going to blow, is going to pop, or break, or bust, or what have you. And depending on the severity of that, it might put you in a stroke, and we know what stroke looks like. Or depending if it pop, but if one or more vessels bust, then you die. So it's a life-saving situation, whereas Viagra and those things is more for quote unquote pleasure. So now one is decreasing blood pressure, while the other one trying to increase it again. So that's why you can't they compete against each other, and that's why they don't want you to. It's not recommended to be using it while on high blood pressure medicine, that kind of thing.
what is it that causes, like, so let's just talk about the man that maybe is not battling with um high blood pressure, but he is still having erectile issues. What are some of the things that causes erectile issues in men as they age and get older?
Well, age is one of them, and as we age, the testosterone levels start to decrease. So, alcohol is also something that smoking, alcohol, they also affect the vasculature, I mean the blood vessels, which again, everything has to do with blood flow. So, inadequate blood flow, or let me back up, good blood flow will help with erection. So, as we age, like I said, the testosterone level also starts to diminish. That's why you hear about testosterone therapy and all the other supplements to aid in therapy. But if you, as we age, that's just a normal form of aging. Those things is going to wither. It's going to fail. It's going to get weaker. And not, we're not getting stronger as we age. We're getting weaker. So
Yeah.
things start to diminish. So the testosterone level is one of the big things. Besides the blood flow situation that we've seen in hypertension, testosterone level is one of the major issues. That levels start to diminish. So either we need testosterone replacement, or we do it with supplements, or eat better. But if we also smoking and heavy alcohol abuse or usage also will diminish that. But ironically, I started to see young guys, I say under 40 in my practice at the time, in their 30s. They come in for a foot issue, and I'm not a primary care doctor. I'm a foot and ankle specialist. I can give medication for just about anything, but I'm not treating that, so therefore it's not uncalled for. But I could give you samples, and guys would come and say, "Doc," to whisper to me, "Hey, Doc, by the way, do you guys?" And I used to practice in an office where it's with a primary care doctor, so
Mhm.
we had all the medication samples from the pharmaceutical reps, and guys would say, "Hey, Doc, by the way, you know, I'm having a little issue." And I'm like, okay, I just took care of a few. What issues you having? And they're like, made a little shy, but I'm having a little issue down there, man. You got some samples of Viagra, anything in the office? Give them a couple samples, you know. But in their 30s,
Mm.
shouldn't be having those issues. But for some, it started in their mid 30s. And maybe heavy alcohol, drug use, smoking, those things will also affect you. They're young enough to still be able to not have erectile dysfunction, but sometimes lifestyle also can create those issues sooner than normal.
So that kind of leads to my next question, because I was going to ask you, a lot of times with marijuana being legal, recreationally legal now, and men are partaking, men and women both are partaking in, marijuana use, and they're starting off a lot younger. So we're talking about, like, maybe you start smoking weed at 14, 15 years old. Now you're 40. is this one of the things that can cause like erectile dysfunction, if just constant marijuana use?
Marijuana has and I'm not the expert on that, and I'm not sure how much research has gone into that part. What I do know for sure medically, alcohol and smoking, drug abuse. I'm not sure because you got CBD, there are a lot of claims of what CBD can do or THC within the marijuana aspect. Medically, I don't have all the knowledge based on that level of research or how much that helps. What I've known about marijuana, they have always been stated as it was a gateway drug to other drugs that can create those other issues. So now that is becoming quote unquote legal. Alcohol is legal, but alcohol in and of itself creates other issues for other health issues, like I just alluded to. Can be a detriment to certain aspect of your health. So the marijuana part of it, I can't speak professionally as to all the claims that marijuana can do, but I'm sure there's some level of effect. I'm not sure pros or cons, the true benefits of what that does. As they grapple with what is or what isn't in terms of the legality and the medical aspect. I mean, I've heard where I've spoken to some doctors who deal strictly with that. They talked about it having glaucoma and eye issues and some of those things. The sexual part, I can't, or the erectile dysfunction, I don't know the specific, to be honest, benefit or lack thereof with using it, how that helps with erectile dysfunction. Some may say it does, some may doesn't, but I don't know the level of research
Mm,
to,
I'm just,
to
I'm
offer.
just curious, and I just was curious if it's, because it seems like it's an increase. You just said with marijuana use, and then you mentioned, 3 million men or even younger men now are
It's
coming saying that, you know,
it's. I mean, I think it's there's a multiplicity of factors. I don't think
mhm,
there's any one thing.
okay.
Um, as we age, like I alluded earlier, testosterone level is a problem that diminish. So
Mhm,
we're going to start to lose some of that as we age. Diet also is helpful. If we're not eating right and we smoking all day and we drinking all night, those things will also impact that, which will affect our blood flow. Blood flow also plays a major role in erectile dysfunction. And if you add the metabolic situation like the high blood pressure and the diabetes at a young age, and then you're on medication, that too will also impact that. What I've always known about marijuana in my teaching or my learning experiences over years is that it was a gateway drug. Did it help or did it harm? We didn't, that wasn't officially specified.
mhm,
Now there are a whole host of so-called benefits that medical marijuana can help with. Is it fully the teaching in medicine right out the bat? I don't know. Everyone, well, it can do this, they can do, cure. But what is the teaching that our medical colleague that has done full research on it teaches us as doctors and said, this is what marijuana does, and these are the side effects, so this is what it does, or lack thereof. I don't have the full, um, I won't say understanding, but I go strictly on what the research fully says, and I don't have the full knowledge as to all the benefits. There are a lot of claims, but is it true? Can I go
mm,
out there professionally and say, well, marijuana, I can talk on the things that I know to be sure, from a doctor who's practiced for a long time and did a lot of things. I can speak on those and some of the side effects I may have encountered with certain things. But those things I told you that relates to erectile dysfunction, all of those will lead to that at a younger age. Like I said, a lot of these guys, like I said, smoking, at a younger age, and I'm sure it probably will impact erectile dysfunction, but I can't officially come out and say resoundingly as a professional that yes, it fully impact that. But I do know smoking as a whole will impact erectile dysfunction as well as alcohol will do, or lack or diminished testosterone or poor diet or aging process, all these things can lead to that. Or like I said, on having other issues, diabetes and hypertension, and then being on these medications will also lead to that.
Hmm.
All those things is a multiplicity of factors, not any one thing, but all of those are contributory.
Thank you. How about how important is knowing your vitamin deficiencies and if your body is absorbing the nutrients that it should or you're getting enough vitamins? How important is that? Like B12, vitamin C, how vitamin D, how important is that
Those
in
three, in
terms of
and of
health?
itself, that you just called, are extremely vital because a lack of those in your diet can create major medical issues. Major medical issues if it's too low. I don't
For
want to jump
example.
into. Um, you need vitamin B12 for absorption, um, and if that's lacking, then you have a major issue. You need vitamin D, which is absorbed through the skin, and if that's low, it can create problem with bone healing and all of that. And vitamin C can cause scurvy, and that kind of it's a major health issue with bone. A lot of it has to do with your bone strength and all of that. So it's extremely important. But this is where you go to your PCP. So to help with those things, because if, for example, we live in Northeast Ohio, and it's always winter for the most part.
Mhm.
We don't get enough sun because sun is a great source of vitamin D, but we don't get enough sun. Now, if you live in Arizona and those tropical climates, yeah, you're going to get sun all day, so you get a better source. So we usually covered up. We're wearing long sleeve this, long sleeve that. We're barely getting enough sun, so we're not getting enough vitamin D. So we will lose vitamin D as a result of that. And again, it's the sun is a very major source of our skin for the vitamin D. So now we need supplements, and that get eroded quickly over time if we're not getting it done. But how do we know we are lacking? Now you need to go to your doctor, and when they do those tests, they will know those things are missing or lacking. Therefore, they can put you in vitamin supplements to to alleviate some of those medical conditions that will um, can happen or will happen because those numbers are normal. I
Yeah.
personally had a situation at inserting myself where my vitamin D was extremely low, lower than normal, and I was feeling lethargic. But I thought, well, maybe I didn't get to the gym, but it just kind of wasn't my true self.
Mm.
Um, but I'm a healthcare professional. I've always worked out, stayed in shape. But for whatever reason, didn't think, didn't. I'm a medical guy. Didn't realize. Then when I went doing my normal, I maintained my doctor's regular, just annual checkup, and running numbers, random my numbers below. I repeat, below the abnormal levels.
Yeah. I just
Sub
had a similar
sub.
situation where my vitamin D was very low, and I found out that just as African American people that we don't absorb vitamin D
As
as
well.
well,
Yeah.
and it actually made a complete and total difference
Yeah.
in just my attitude, how I
Yeah.
was feeling, my
Yeah.
energy levels,
Exactly.
just taking and I mean, my vitamin D was, like, extremely low.
Mine was too.
It's like
Just to, not asserting myself, but just to give you an example, was below the norm, was subnormal, which I didn't. Again, I was sort of lethargic. I mean, just like you were talking about,
yeah,
but I didn't really know. I would never thought about. I wasn't thinking about my vitamin D levels. And again, I'm professional. I understand how all those things work and what they can lead to. But as a result of that, I was just, when my doctor did say, by the way, doc, your your vitamin D level is this, and again, I know the numbers. I'm like, wow. So immediately put me on supplements, and within 3 months, I was back to normal level. But now, as part of my norm, I make sure
yeah,
I maintain vitamin D and make sure I keep all those other supplements, um, going. So
yeah,
therefore, I'm not, and I feel 1,000% better. But I didn't realize. I just knew I wasn't quite myself.
yeah,
But again, and I'm professional, so it has nothing to do with your level of professionalism. Even you're a medical person. It's just that those things creeps up on you. And again, person of color, we don't get enough sun. I'm not out there in the sun. I'm not exposing myself to skin cancer, none of that, myelomas and all those kind of things. So, you try to be concerned about that, but then you harm yourself by not doing. So anyway, supplements was able to help me get back on track in a short period.
Yeah, vitamin D is very important. I just
Yes.
like even my son, he was kind of like, "Oh, I'm so tired." And I was like, "You need some vitamin D." He was like, "Ma, I start taking vitamin D and I feel like 100% better."
Yes.
He's in the Navy, he works out
Yeah.
all the time,
Hmm.
but he needed vitamin D. He live in
Yes.
Virginia, but he still needed it.
Yes,
So,
and that's the key. We are not exposed to the sun long enough for our bodies to give us the recommended dosage that we need. And therefore, over time, it continues to erode because if you're not getting supplements and the sun, which is the natural source of helping it, helping it to develop to our skin, isn't being as functional, then henceforth the lack thereof, and for many of us, that would lead to that.
so can you talk about a little bit about how often you should get your prostate checked and how often and the issues surrounding the prostate and why it's so important to get your prostate checked?
So prostate for men is extremely important. Now, it should be checked, I would say, annually by your doctors. I mean, whether through the PSA, but I think a physical. I mean, again, that's not my area of expertise as a physician in that area. But my understanding is that um, prostate, whether the PSA is just a blood test, but a prostate should be done to me as an annual exam. The prostate should be checked. Digital rectal exam should be checked, I would say, annually. Um,
Now, I know that's not happening.
right.
in our
And
in our community, I know like that was my next question was how often you should get a rectal exam. And there's a difference between a rectal exam, which my understanding is supposed to be done annually at your with your primary care physician, at your annual checkup. And then
right.
that's the rectal exam. And then there's
Before one thing, it should begin at, and I didn't say, I should have said that. It technically begins at the age of 45, your first one, assuming there's no family history or familial history of a prostate cancer. So the age is at 45 for men.
45 years old should be getting your prostate checked.
Yeah. Then initially the first one,
Hmm.
if nothing else, it should be the first one.
And then
Um,
every year after that.
um, Let me back up. That's the colonoscopy. The prostate should be checked, like I said. Well, every year it should be checked on a physical exam. Some people don't want a digital rectal, but they can do a PSA, which is just a blood test. But the physical exam, digital rectal, gives you more. The doctor can feel it, whether it's enlarged or what have you. But for the people, the men who not too happy with getting a digital rectal exam, at least they can do the PSA for starters. And if that's elevated, it gives the doctor something to go on. But yeah,
So just so I'm clear for the audience, rectal exams should be done
digital rectal.
digital rectal exams should be done
I
annually
would say
at your
yearly. I
year.
believe, yeah. I believe the doctors. I think and again, that's not my area of expertise, but I believe it's annually for doing their annual physical exam that they do a prostate um, digital rectal.
And that should start at
Age
that's
45.
at 45. And
Age
then
45, the first one.
for colonoscopies, you should get a that's where they check with the camera with your
Yeah,
colon.
that's what now, let me back up for a second. Let me back up.
Okay.
Let me back up. Excuse me. The colonoscopy, because they both kind of run the same thing. For the, let me go back to the prostate. The prostate should be checked annually at your annual exam. That should be checked for a male. Period. Especially start to get in their 40s, 40, 45, should be checked annually just to make sure nothing changed. For the colonoscopy, the first one should be done at age around 45, age 45. That's where that is. Just to make sure there's, as a baseline, there's no issues.
Okay.
Just
And
that
the,
to conflate both. Yeah.
and so should the prostate like annual exam starting, when you're sexually active, or is this something that should actually doesn't you don't need to get your prostate checked until you're over 45?
Oftentimes, and again, I'd like to make sure I put that out there as I'm not the PC, I understand it, but I'm not the PCP guy, the primary
Mhm.
care or the urologist, because oftentimes these things are changing. They're moving the goalpost of how soon they want to do certain things.
Mhm.
Some say maybe 45, some maybe move it to 40. But the average sexually, let's say in your 30s with no issues, then I don't. I mean, I think they can do it, but I'm not sure if they actually how they may opt to, because some guys may be like, oh well, doc, I'm not having any issues, so they may opt just to get the blood test, the
But you
PSA.
should definitely be getting the PSA test done
I say at
at
least
your
by
annual
40.
checkup.
Well, yeah, they should at least be checking once you get, especially if you have family history of cancer, especially prostate cancer. They may start a little earlier. But if you just the average 25, 30 years old, I think they kind of get past that. Um, but once you hit 40, they get more hands on with, okay, you need to get your prostate checked. But I'm not sure where they've moved the goalpost in terms of how soon. But definitely, if there's a history of cancer or prostate cancer in the family, they start much sooner in checking to make sure that they cap. It's just like women with breast cancer; they start sooner as opposed to if their family history. Family history means a lot.
Yeah.
So if there's a family history of anything, we will start sooner in our detection process. But if there's no family history, then we're like, okay, well, there's nothing really to jump on or jump ahead on, so we let it go. And we
Okay.
can get you on a PSA. But I know in the past, early on, even me, I wasn't too didn't want that kind of invasion. So like, okay, let's do a PSA.
Yeah.
Okay, doc, let's do a PSA. So my
But a
doctor, well,
PSA at least is something that is
it's a blood test. It's a blood test.
yeah, and it's something is it something that's in every, annual exam, or is this something that we should be asking for?
Well, I think it's, and again, I don't want to speak for those doctors, but um, the doctor, the primary care doctor, has a list of things that they want to include in their annual, especially based on that patient's history. The prostate may be one of them. For the men, maybe one of those things they want to include. Everyone has their own protocol, and depending on the institution they work for, they may have a list of things that at certain age, I don't care what you're all doing, this is what you need to go through. And I'm seeing that more so now than ever. They have a list of things they want to check. So it may vary from institution or primary care doctors, but depending patient, oh doc, I don't have any issues, no family history, so you may buy time with the PSA, which is the blood work. But then it gets to a certain point of, okay, you're 40 years old now. Maybe I need to do a digital rectal exam. The PSAs were good, but it's not a definitive test to give you that, to tell us. So the doctor may want to say, okay, let's supersede what you're doing and do a digital exam to get more of give us a better exam.
Thank you. So I polled my audience, and and they sent me questions to
Mm-hmm.
juicytalk@gmail.com, and they had questions that they wanted me to ask you. So I want to ask you these questions, and it's a couple. One of the questions was, what is included in annual what should we include in our annual doctor visit for men? So they basically saying, what is it that they should ask for or should be included in an annual doctor's visit?
Okay. Um, and I would say male and female, it varies. For the male, okay, so for the average person, the doctor going to go through the full comprehensive eye exam, um, all the blood work, comprehensive blood work, because the blood work will tell us a lot, even when it didn't show up on you, right? So part of that is your physical exam, your eye exam, blood pressure, your vitals, check that. If your blood pressure is too high, then okay, certain numbers, are you hypertensive? Because like I said, alluded to earlier, high blood pressure, aka hypertension, is a silent killer. So if your numbers is extremely high, those things would be um, also give the doctor a reading. Also, again, they'll test your neurological status, your sensation, circulation. Make sure your system, a complete system review. Whether you got neuropathy, numbness, foot exams, all those things. And for female, obviously, they may include a pap smear, breast exam, or may send you to go get a breast exam, what have you. In the men, would be a prostate, PSA numbers, along with a comprehensive metabolic panel, meaning covering just about everything that the blood will show up in your blood. It shows kidney dysfunction. It shows everything. So those things will be included in that, um, in your annual, And depending on the situation, they may deem that you need a colonoscopy. Send them a send for colonoscopy. Recommend a colonoscopy. So it all differs on where you are based on age and based on family history. So two things will drive your annual exam: family history and your current history,
Mm.
and also including your age. So those three things will determine what you need to have. So I mean, maybe 50 years old, doctors, okay, you haven't had a colonoscopy in you haven't had now you need to get a colonoscopy, or you haven't had an eye exam in 2 years or 3 years, or pap smear or whatever it is, who knows what. So those things will be included, or breast exam, annual breast exam. So so these things may be recommended, the full workup of everything, and the blood would also show whether you're deficient in B12, vitamin B12, or D, vitamin D, or osteoporosis, or all those tests will be done, and depending on the blood work, those things will be instituted.
So a
So
so a full a complete metabolic panel will let you
mhm,
know about cholesterol,
yes,
vitamin deficiencies,
kidney function,
kidney function. Okay.
whether you got an infection or inflammatory disease, they'll do a full panel, whether you got inflammatory or arthritic condition like arthritis and all those things. They'll do a full panel that would detect all those other issues. So you may have arthritis brewing that you didn't know, and all of a sudden you may have certain symptoms, but might be vague, maybe vague symptoms.
Mhm.
And all of a sudden to do a rheumatoid profile is, oh, by the way, she got some inflammatory disease going on,
Mm.
or popping up. So although the blood work could also be so doing in depth blood work as well as full body review, um, and all those things
Thank you.
from head to toe.
Thank you.
Welcome.
This may be a little bit like the previous question. Are there any testings that may be needed or available, but you have to ask for it specifically?
Um, yes, there are tests. I will say based on you, the individual, because the best doctors to me are the ones that you communicate with, because we can, if you don't, they said a closed mouth doesn't get fed, right?
Mhm.
So if you don't tell me what's going on with you, I can't assume what's going on with you. So if you tell me your conditions, and that you feel that something that you didn't tell me, I didn't detect, then you will tell me, or you say, Doc, or you may say, I need, or this is what's going on. Then I'm going to determine what tests I need to order. So yes, those things are important. You tell the doctor your condition, because you may or may not know what test you need or what's available, because you're not the doctor. But if you tell me the issues or complaints you're having outside of what initially you have said, a patient may tell me most things and neglect the most thing. The most important thing is at the end, Doc, by the way, I forgot to mention that this was going on with me. Oh, really? Okay. Well, maybe I need to send you for an MRI. You see what I'm saying?
Mhm.
So from that perspective, the patient not necessarily tell me he or she needs an MRI, but that condition or that situation that you just mentioned may prompt me to order an MRI
So
or
be
whatever test
transparent.
available.
So it's
Excuse me?
important. I said, so it's important to be transparent with
Yes,
the doctor.
yes, because we can't guess what's going on with you.
Yeah.
So you have a child, and you may think for the most part when that child was hungry, so you will feed him. But he may be hungry and want something else. But if she didn't tell you, you don't know. You're just going on what you think is, and he might be hungry like, Mom, I'm hungry. Now you know he needs to be fed,
Mm-hmm.
as opposed to going on what you think is his time that you need to feed him. I'm just saying. So if you don't communicate with your doctor or your lawyer what ails you, we don't know. Oftentimes we may have to pick it up from a blood test, but only you know. No one knows you better than you.
That's true. Be
So you
your
can
best advocate. You are your best advocate.
absolutely. You just said it. That's the key in medicine. You must be your best advocate, and also, if you are not in the position to be that, then your loved ones should be that. Your spokesperson should be the one to be your best advocate for you.
That's good.
So now you can communicate that to your treating provider.
Okay. And are there any key things men should ask their doctor during an annual checkup?
So your doctor so just like for the people who are in finance, you talk to your advisor about your investments and what you want to, how much money you want to invest in and buy and sell and whatever you may want to do. Guess what? Your investment is your health.
Hmm.
So you should be able to ask your doctor anything. So now they can be your best advocate to help you invest in your health, in your life. We don't know. We can only go as far as you allow us to go. So if anything that you need to ask, but it comes down to initially trust.
True.
As a female, when you go to your OBGYN, you exposing yourself to this person. You tell them all the most intimate things that goes on, and they're going to ask the intimate questions. So it's a level of trust, and you ask them, and then they will try to dissect or solve the riddle, whatever your situation is. So you should be able to feel free to ask your doctor any and everything. Now, the doctor is not God. He or she doesn't have the answers for everything. But because we have consultants available, we may say, you know what? I think this is outside of my realm. Let me refer you to the foot doctor. That's his specialty.
Mm.
Or let me refer you to the cardiologist because you're having some problem with your heart, maybe a heart murmur, whatever your condition is. Let me send it to that person. So this is where asking that question, and no one knows everything, can refer you to the right person to have those conditions answered or situation solved.
Awesome. Thank you. And the last question we already covered, which is explaining how important a primary care physician is, but we already touched on that. I think this has been a really great conversation, and I think that our community is going to be really, really blessed to have this podcast to listen to refer back to before their checkups, and just is a very this was very good. And it's a conversation that just needed to be had. And I'm so happy we was able to do it today, Dr. Jones. And I
Thank you.
appreciate you. I would love for you to come back when your schedule frees up a little bit so
Sure.
we can do a Q&A and we can have people come on and they can ask you questions that they may have. So I thank you so very much for taking the time out your day to come on my platform so we can get this information to the community.
Thanks for having me. I hope it's helpful, and maybe next time I'll be able to do it live.
Yeah, and I would love that. And I know that Hardy wanted to be here today and he was unable to be here,
Right.
but he speaks very highly of you
Thank
and
you. I
thinks
appreciate
very
you.
highly of you. So
Yes.
thank you
Thank you.
so very much. I appreciate you.
I hope this was beneficial to your listening audience, and
I'm sure
there it
it
is.
was. You shared a wealth of information. We're very appreciative and thank you.
Thank you.
All right.
All right, bye.
Bye-bye.
Bye bye.
So that was such an informative conversation. I want to thank everyone who tuned in today. Thank you for being a part of Juicy Talk today, men's minority health. Some of the things that I just want to take away and I just want to speak on that Dr. Jones spoke on is you got to be able to trust and communicate with your doctor. Make sure that you are asking for a full metabolic panel when you're going to the doctor. And also, it's very important to have a primary care physician. Definitely important. So if you don't have a primary care physician, call your doctor's office, call your insurance company, see what providers are out there so that you can get a primary care physician, because it's very important and they are the gatekeeper for your health and your medical health. So thank you so much for tuning in. Again, I want to just thank Dr. Harold Jones, I'm sorry, for coming on and speaking with us today. And this was such an amazing conversation. You guys take care and thank you for watching.